Good morning, everyone. Welcome to Fakeeh University Hospital's webinar, and thank you for being with us today. It's an honor to introduce our speaker, Dr. Monica, who holds a doctorate in clinical psychology. She earns the European Alliance Against Depression Award of Lisbon University, among other awards. Dr. Monica is also fluent in English, Portuguese, French, and Spanish. Today, she will discuss the timely topic of brain rot, explaining how habits like excessive screen time affect our brain health and sharing practical strategies to address these challenges. We encourage you to stay until the end of the session, as you will have the opportunity to unmute yourself and ask Dr. Monica your questions directly. Please join me in welcoming Dr. Monica.
Well, thank you. It's also an honor to be here and to talk about such a recurrent and interesting team. So welcome everyone that has joined today. And I would like to address one of the famous terms that of this year. What is brain rot, and what are the psychological impacts of brain rot? See, it has been, sorry. Okay. So brain rot has been considered this year the word of the year by the Oxford University Press, and essentially is defined by the deterioration of a person's mental and intellectual state and cognitive functions in consequence of over-consuming digital media content, and especially content that it's considered to be trivial or unchallenging. And basically, although it's the word of the year and never before has been so used, what we know is that actually this term has been found before in literature by Thoreau, that was a philosopher, naturalist, and in his book, he already criticized society to this tendency of developing complex ideas and overconsume simple ones, and that wouldn't require too much thought, and that would many times lead to a decline in intellectual effort. It's interesting that since that time, this word was somehow recovered now, but somehow with another additional meaning. And nowadays, what we have been finding, and very recent research has been very consensual in addressing the impact and the negative impact of overuse of digital media, and what is the consequence in the brain's health when we tend to spend too much time facing the screens, for instance, the computer screen, the mobile screen, and what is considered too much time. Actually, more than 2 hours in a row, if prolonged, and we are not talking about one day. We all have been facing screen time, endless hours every day. So what has been the impact on that habit now? What we see is that it has been associated with increase of levels of fatigue, mental fogginess, reduced attention span, also higher levels of depressive symptoms and higher levels of anxiety. How can this be explained? Why would the time of exposure to screen time, but also the nature of the contents, be related with the decrease of effective brain functioning? So one of the reasons is that we know our eyes is the first connection to the brain. And one aspect that curiously has a major impact is the fact that nowadays everyone tends, the first thing that when they wake up, instead of, for instance, looking at a landscape or in a certain object that is further, or even looking at the children, the park, the first thing that they do is looking at the screen. Now, what is the impact? Is not only about looking at the screen, is also what kind of content do they get in touch with? And normally, for instance, people tend to immediately either read the news, and normally the news don't come with with the best positive facts, because that doesn't increase dopamine. Normally, we read bad news, otherwise it wouldn't be news. Which means that this is one of the behaviors, so not only in the morning, but during the day, that scrolling constantly on negative content is proven to not only increase chronically the levels of cortisol, but also dopamine. So high levels of cortisol will lead to a constant fight or flight response. That's what cortisol is helpful for. But if it's raised for very long periods of time, what happens is that it has an inflammatory effect, not only in our brain cells, but in all our body. That is one consequence. The other consequence is also us being exposed to constantly high levels of dopamine. And this is what can trigger then addictive behaviors. We become addicted to a certain behavior, not only substance we can be addicted to. We can be addicted to behaviors that tend to increase the level of dopamine. And scrolling constantly on negative content indeed becomes addictive. Also, the levels of depression increase, and that is absolutely already evidence-based and concrete. Another aspect why I'm showing here the brain is that, so this area is the area responsible for logical thinking, decision making. That's why when we are very, very tired, normally this area because if we are tired or if we are under stress, there is here the amygdala, that is the center of the fear, that basically lead us to a fight and flight response. So what happens, interestingly, is that when the amygdala is hyperactivate, it blocks this area. So when we are in the stress, or when we watch too many negative news, or when we are set, for instance, when we receive constant notifications with constant emails that trigger a fight or flight response, what happens is that if we are under stress and high levels of cortisol, our frontal lobe, the neurons here, actually they get blocked. I mean, it's a defensive mechanism of our brain, very smart, but makes us dumb. What means is that we actually, if we are under stress, we tend to not make this, it's difficult to make decisions, even simple ones. It's difficult to think rationally. And that's one of the reasons why actually we can become, our brain can be rotted. We can be cognitively less accurate if we keep not only under stress, but stress related with too much consume of low content, negative content, too much screen time along the day and along the weeks, along the, the months. So that's why I wanted to show here. Of course, this is very complex, and we will be showing very in a very simplistic way, but just to understand a little bit more why it can have an impact. So when I mention, you see here the amygdala. So it's called amygdala because it comes from the Latin and means almond, because it's a gland that is the size of an almond, but extremely powerful. So whenever we are doing one of the brain rot behaviors that is called doom scrolling, because we are constantly exposed to negative content, or for instance, even worse, content that is offensive, content that is linked with cyberbullying, negative comments. What does that mean? It means that we immediately react as if it's a stress factor. We are under threat. And for that flight and fight response, that fight or flight response, is mediated by this small almond, neural almonds here in our brain, but then does something amazing that is going to protect this area. That is the area where, again, responsible for being wise, for making decisions, for being rational. And what happens then is that we tend to start feeling that we can actually not think very logically. Very small decisions is difficult to make, and that even it's a vicious cycle, because we start having difficulty in thinking, in processing complex information, and even the speech ability is affected. because we start not being competent in that, we also start looking for low quality content. I mean, so basically, the less complex information we deal with, and the more stress we induce in, the more we will tend to just consume very simple and sometimes even a little bit trivial and pathetic content, because we start feeling not able to process complex information. And this is concerning, because in such a time like this, where yes, we have more information, but because we are overstimulated, we also have less capacity to process that information in a logical way. So this was to, then there is also influence in, for instance, the temporal lobe, very important, because when the amygdala is hyperactivated and very high levels of cortisol, there are other areas of our brain that they don't totally stop working, but they work less. And that is, like I said, the prefrontal cortex, and very important, the temporal lobe. So the temporal lobe also gets blocked with high levels of cortisol, and that's why people start thinking, start feeling that their memory is not the same, and especially the short-term memory. Someone tells them, no, 5 minutes ago, and they forget that information. So it's concerning, the impact of brain rot, and I want to just explain basically what is involved in our brain and why it affects us. So basically, again, because of constant high production of cortisol, very in a chronic way, and high levels of dopamine, curiously, what we start feeling is that our productivity decreases. We start not being able to complete tasks. We start procrastinating because we can't think with the same accuracy. Basically, what the over-consuming digital contents of low, let's say, quality, and too much screen time does to the brain exactly what, for instance, excessive alcohol does. And alcohol is a toxin, and what people want to feel sometimes is that they calm down. Actually, is not calming down. What happens is that because alcohol is a toxin, our brain defends itself by blocking precious areas of our brain, that is the prefrontal cortex. So we can't think logically. Yes, we don't overthink, but not because we are in a good state. We don't overthink because actually we are intoxicated. The screen time has the same effect. Prolonged. Of course, mental fatigue. And that's where we start also being unable to think in a creative way. That's concerning as well, because the less creative we are, the less original. So we start being, in terms of identity, also the identity ends up being, we are just like everyone, which it's the waste, because each one of us has very unique potential. And that's because we have a wonderful area in our brain called prefrontal cortex that basically sometimes we are destroying with certain behaviors. So the cognitive decline, the critical thinking, gaps in memory, gaps in problem solving and decision making, and the focus on completing tasks becomes more challenging. Again, why? Because it affects the prefrontal cortex. Okay, hyperactivation of the amygdala, high cortisol blocks then this area. Okay, so stress kills us, literally. And one of the aspects that screen time, prolonged screen time, and being exposed to constant negative content or attacks or somehow criticism and basically not positive aspect, actually it has a detrimental effect on our function, our mental health, but specifically emotional health. So very likely that we will develop depressive symptoms, anxiety, and then cognitive symptoms. Our social skills also tend to be impacted. Why? Well, also because if we don't engage, we start having a way of socializing that is not what we are biological programmed for. I mean, we socialized with, we should socialize in person with all our senses, right? We need to recognize smell, we need to recognize the sound, the feelings, being next to each other, just mediating social interactions through our eyes and just using one or two senses, actually it declines our social competencies and even our capability of assessing others. If who do we really want that person in our lives or not? I mean, if we just have access to an image and what that person says, that's not enough to assess if we want to keep interacting or not. So our capacity to socialize starts being reduced also because if our prefrontal cortex is not functioning so well, it means that we don't think so logically. For instance, we probably are not that interesting to what we tend to talk about tends to be not that stimulating. And so that also has an impact. I mean, we don't really have anything too meaningful to say, that has an impact on our social skills. See, in terms of another aspect is really the mood, the lack of motivation, isolation, very much related with disassociation between overexposure to negative digital content, overconsume of digital content independently of the value, and also the fact that we tend to be too, especially at night, we tend to spend too much time on the phones. Why is this important to take into account? Because at night, and why does it impact psychologically? because it tends to be associated with sleep disorders. And the sleep, when it's not good quality, it leads to higher levels of anxiety and higher levels of depression. So what happens if the last thing that we do, or if we spend 2 hours before sleeping on our screens, first, if we are, again, just almost addicted to negative content, that per se increases dopamine and then cortisol, will be much more difficult to relax. Another aspect is the kind of light that the screens produce. I mean, the kind of light is the same kind of light that surgeons have to use when they do a surgery. And why? Because it doesn't let them fall asleep. So that kind of light that we are exposed in the screens and in the mobile phone keeps us awake because it actually interferes with the dopamine. The dopamine and the melatonin. So it interferes with the pineal gland that produces melatonin, and melatonin is essential to regulate the sleep and the circadian rhythms. So we start creating an imbalance on melatonin. Then, because we don't expose ourselves to sun so much, there is lack of many times of vitamin D that also impacts on the production of dopamine. And this results in what? Us not being able to sleep. If we are not able to sleep, our brain doesn't reset. We become more anxious, we become tired, and we are less productive, we interact in less effective ways, and that also leads to depression. We start losing people in our lives, and that leads also to depression. So another aspect, this is more linked with the kind of contents that we are exposed, is the comparison, right? Comparison ourselves in not, I mean, we don't tend to be very kind with ourselves, unfortunately. And that has an impact, not normally, unless, I mean, in a narcissistic disorder, probably is the opposite. But we tend to compare ourselves in a more negative way compared to others. And we start thinking that we are not good enough because that person has this and that. And this is extremely dangerous in terms of self-esteem. Because we are only comparing, we are comparing all of our identity, our value as a person, just based on one dimension of someone else, which is not fair, and it's basically is not that intelligent, because I mean, a person has many dimensions, and we don't see what is behind. What is behind, for instance, okay, we can see a very fancy car, but we don't know if that person is in debt or if it's facing financial issues, and if it's have an impact on friendships and family. So we don't see all the other aspects that are not so pretty. Also, many, for instance, with many young adults comparing, I mean, it's good to improve and it's good to admire, but not at the price of us getting depressed, because then it really impacts our well-being. And so even for instance, the body image, that is also a very concerning aspect in young adults. They see skinny body, let's say, and having many likes. They don't see the struggle behind that, and sometimes an eating disorder that is devastating for families as well. So we have really to be careful about comparisons. Another aspect is that we tend to have less time for self-reflection, to know ourselves, right? To think about what we really like, what is, do I really, I mean, is it just because others have this and this and this? Is that really important for me, or do I value other things in life? But sometimes our identity gets diffused, and we end up not knowing who we are, what makes sense for us. And then sometimes engaging in the risk behavior, again, because many times we tend to look for immediate rewards. And of course, what gives immediate rewards, it's involved with pleasure, and very potentially can trigger an addictive disorder. Other aspects is the posture, right? The fact that we constantly do this. That's another thing and a tip. If this area is not well hydrated also, and if it's constantly in this position, actually it has an impact also on anxiety. So always keep high levels of hydration, and this area is actually very important, because here is also where if people are under stress, it's also because this area, where you have near the amygdala or the cerebellum, that area is hyperactive somehow, is working a lot, because we are to keep us fighting, to keep us in that alert mode. And the eyes, again, it's the first connection to the brain, and you really need to keep your eyes healthy. This is very important. Sleep disturbance, again, related with especially too much exposure to screen light that dysregulates the melatonin. Then you don't go out so much, you don't get sun, low levels of vitamin D. Also, if you are constantly seeing negative contents, this really has an impact. Why? Imagine that you are constantly, every day, facing suffering, facing others' suffering. It's impossible that you will, it's impossible also that you smile, right? If you are, let's say, a healthy person, you have some compassion. So if you see suffering, that affects. Imagine the human being is not programmed to lose people every day, to grieve every day. Imagine what it is that every day someone dies, someone that you know dies every day. How do you recover? psychologically. So in life, fortunately, we don't experience losses every day. And that's why we don't get chronically depressed. But if we are in touch with constant negative content, it's the same of experience that every day. And that doesn't allow us to recover. It's like we are constantly in grief. So that really leads to anxiety and sleep disorders. So basically, if we can summarize in a nutshell the basic what is brain rot, so that condition of deterioration of our cognitive capacities, fogginess, lethargy, reduced attention span, cognitive decline, but also higher levels of depression and anxiety, caused by over consuming digital content, but especially low quality or negative content. Is the same of, let's say, why it's so impactful in terms of our mental health. Because if we keep consuming just, that passive screen time leads, it's the same of, it's the same of consuming sugar constantly, instead of us having a meal, vegetables, proteins, we just eat sugar. Yes, it gives you energy, but there is no way that you will not get sick. With our brain is exactly the same thing. So consuming easy content that is easy to digest, it's like consuming fast food. It leads to metabolic diseases, almost for sure. If you don't nurture your brain with the proper information, the proper level of stimulation, your brain gets sick. And especially this amazing area that we have, that is our prefrontal cortex, that is actually what distinguishes from other animals. So if I would love to hear some questions, doubts, and I'm here to reply again. This was very simple. This is complex, but I try to make it simple, not to create brain rot. Okay, this is good content, but at least to bring some awareness of the risks, and for us to be more mindful regarding not only what we eat in terms of food, but what kind of food for the thought we are consuming.
Thank you, Dr. Monica. Everyone, please feel free to ask any questions. We can unmute you right now, so you can unmute yourself and ask Dr. Monica directly any questions that you have. We're waiting for you. If you don't really want to unmute yourselves, you can comment with leave a comment with your question.
Oh, we have questions.
We have previous questions from Farhat. Can negative content and screen time lead to long-term stress or anxiety in the brain?
Yes, absolutely. Then thank you for your question. The very relevant one. So as I said, is one of the brain rot behaviors is what we call doom scrolling. So the constant exposure to negative contents it increases dopamine levels, but it also increases cortisol, because somehow, I mean, what is negative is what can kill us, right? I mean, it's not very much that we get sick, and if because of negative aspects, not because of what brings us goodness. And so the negative content indeed puts us in a constant fight or flight mode. And what does this mean? This means that our levels of cortisol are very high and permanent. And cortisol is this stress hormone that in a short time can be miraculous. I mean, that's why we can run from, let's say, a tiger, but we don't have them, we don't do it anymore here, or we can face traffic, let's say, replacement for lions and traffic. We can react, but imagine that you are constantly reacting. I mean, imagine if you are constantly seeing car accidents or having car accidents, or you are constantly seeing people sick, if you are constantly seeing people dying, or if you are experiencing that every day. We are not programmed for that. We are programmed to, yes, negative things happen, but then we reset, because there are other aspects in life that are very positive, and we lose someone, but we have others to take care of. If we are constantly facing negative, our brain and our emotional health doesn't have time to recover. We don't. So we are, and what means recovery? It means lowering the cortisol levels. If we don't lower the cortisol levels, if they are constantly high, what means is that we will start getting physically sick for sure, because cortisol actually is from the same family as cortisone. Cortisone is good for inflammation in low doses, but you can't take cortisone whole life. Cortisol then, in high levels, is actually inflammatory. So you start having much more pain. You start also, it inflames the neural paths. So indeed, it has a negative.
Another question from K. Michael. Does that mean that those negative impacts are from the negative content that the long screen time than the long screen time?
Very relevant question. So both in different ways. So constant screen time affects very much so our vision, and it affects the circadian rhythms, because if the light that you are exposed to, it's the kind of light that will actually block the production of melatonin, and you will need melatonin in order to fall asleep. So if you are constantly under a very the kind of screen light and prolonged, actually you will be over alert all the time. Again, I repeat, is the kind of light that surgeons have to use, and it's the kind of light that you see in hospitals. But why? Because it keeps you awake so that you can actually see what's happening and you can act, you can save someone's life. But imagine that you are constantly in that mode, alert. You will get to a state of fatigue, and it has a huge impact on sleep, and the circadian. You start, getting imbalance in terms of night and day. No longer, it's no longer very distinguished. And also, another aspect is that if you don't sleep well, that leads almost for sure to depression and anxiety, directly and indirectly. First, because you are less productive. If you are less productive, you don't value yourself so much. You don't receive somehow valuable inputs that can lead to a depressive state, but also can lead to anxiety because you can't sleep, you can't reset, the body is extremely tired. Regarding the negative per se, has to do with high levels of dopamine. I mean, we can actually get addicted to pain exactly because of that, because painful content or negative content are much more effective in raising the dopamine, which paradoxically gives pleasure, and then leads to an addictive behavior. So negative contact, constant exposure to negative content in one hand has that addictive risk. On the other hand, it makes you almost addicted to pain and much less able to experience, for instance, positive emotions. That's another risk. It's much more difficult to see the positive if you are constantly exposed to the negative, because our brain gets used to it. But this is not what we are programmed for. We are programmed to, yes, we feel pain, we deal with losses, we grieve, but we are not programmed to grieve all our lives. We have losses, we recover, and we also can appreciate all the other good things that we have. If we are constantly exposed to negative, we don't have any more capacity of even processing the positive.
Doctor, this is a comment from a student. They're explaining how they have to use their laptop because they can't use the medical books. They need to use laptop for studying. So they're asking if this affect them in any way and what they can do about it.
Very relevant. Sorry, the name? Can I?
It doesn't show really.
Okay, but anyway,
Yeah,
it's a very, very relevant, intelligent question as well. Indeed, if you use a filter, it helps. It helps. The problem is that you are exposing your eyes constantly to the same kind of stimulus and during prolonged periods of time. Normally, to do that, you are always in the same position. You don't get, unless you, I don't know if you're studying outside, that can be a trick. For instance, if you study not only indoors, can actually help you. Our eyes need at least 10 minutes of direct sunlight. So not looking directly to the sun, but like this, but we need sunlight. Then to process vitamin D, melatonin, very important. So I would say that yes, it minimizes, but if possible, take breaks and go outside and get sun in your eyes, not with the sunglasses. Is really important.
What supplements do you recommend for concentration, if there are any?
Okay. It's also a very good question. Before starting taking supplements, reduce the screen time if possible, at least at night before sleeping and in the morning when you wake up. So if you can just introduce that in your life, like don't look at the screens before you sleep, at least 1 hour before you sleep, and don't look immediately when you wake up. That will do wonders in your concentration. Also, to control the stress levels. Normally, it's difficult to focus because we are constantly in an alert state. So try to be in nature. Nature, for instance, near the seaside, or a lake, or where you don't have too much stimulus, very rapid. It's very important that, you see, our brain is programmed to process certain kinds of noises in a rhythm that is not like this. The same with visual, okay? And one thing at a time. So if this doesn't work, and for instance, if you can't have resetting times, and also with physical activity, doesn't have to be strenuous, but if that doesn't work, yes, the supplements can be very helpful, especially if, because of your kind of work lifestyle, you start being low in vitamin B1, vitamin B6, vitamin B12, vitamin D, selenium, magnesium, and zinc. So also there is evidence for the alpha lipoic acid that can also help with the concentration. But I would basically recommend a supplement that contains vitamin B1, vitamin B6, vitamin B12, zinc. I mean, not in the same supplement, because then some interact with others. But if possible, for instance, vitamin B1, B12, B6, and vitamin D in the morning, then lunchtime, you can introduce, for instance, zinc and selenium. And at night, unless you are very sensitive to magnesium, but normally at night, magnesium is very helpful as well. If you start feeling, because many patients react very well to magnesium and start having much better performance at night. Some prefer it in the morning. You can also take it with the vitamins. The vitamin C also is important because it's antioxidant and can also help to protect neurons, but take it in the morning, not at night. Yes, in terms of a lot of proteins, very important. If you are not allergic to nuts, almonds are good, or almond milk. Basically, have a diversified nutrition. That's very important, with less, if possible, less processed food.
Thank you, Dr. Monica, again for the insightful.
Kaiser, are there any specific medical tests? Also very relevant. Specific medical tests where normally we do an assessment in terms of we can assess the memory, we can assess certain cognitive functions, attention span, executive perception, executive function. We have instruments for that. We can also see through an MRI and a PET scan, we can also somehow diagnose, because what starts happening is that the gray matter starts being more tiny, which is a consequence also of brain rot. And most important is that sometimes the prefrontal cortex starts also shrinking a bit. So that is, or we see an hyperactivation of all the the amygdala, hypothalamus, all that. So yes, we can diagnose. Normally, consultation with a clinical psychologist can be very helpful for that. Also to analyze the lifestyle and all the habits that can sometimes change and reverse the process.
Someone is thanking you for the session, of how helpful it was, and they give an impact of excessive screen time. Thank you, doctor. Thank you, everyone, for joining, and we hope this webinar shared useful information. Stay tuned for future interesting webinars.
Thank you.